Within the spine, we have 7 cervical vertebrae, we have 12 thoracic vertebrae, and you'll notice that each of the 12 ribs is going to articulate posteriorly with a vertebra. When we look at the vertebrae, understanding the pieces parts, this is the body of the vertebra. Between the body and the posterior structures are 2 little foot-like processes called pedicles. The portions that stick out on either side are referred to as the transverse processes. Right here we have a hole. This is the vertebral foramen through which the spinal cord runs. And then joining together to form a spinous process, we have a lamina on either side. Now, the cervical vertebrae are the only vertebrae in the spine that have transverse foramina. Okay, a foramen is a whole, foramina is plural. So these are the transverse foramina in the cervical vertebra. Oftentimes you'll see a bifid or forked spinous process in the cervical vertebrae. Remember that we have 7 cervical, 12 thoracic, 5 lumbar vertebrae. In order to distinguish a lumbar vertebra from a thoracic vertebra, we use the fact that the lumbar vertebra tends to have the appearance of a moose. Here's the moose's snout and his jowls hanging down. Okay, and you can see his large ears over here. Whereas the thoracic vertebrae tend to resemble that of a giraffe, little pointy ears and his long, long nose. Now, the cervical vertebrae, besides having transverse foramina, the top 2 cervical vertebrae are specially designed. The first cervical vertebra is called Atlas. The first cervical vertebra is called Atlas. Atlas is just a ring. It does not have a vertebral body. Okay, if it did, the body would be right in here. So this is Atlas. Remember that 50% of knotting occurs between atlas and occiput. Just underneath Atlas, we have the second cervical vertebra, which we call Axis. Because remember, Atlas holds up your world, which is your head, and then Atlas is going to rotate on its axis. Now, Axis has a special tooth-like process. This is called the Odontoid Process, or you can simply call it the dens, D-E-N-S. So here's the dens. Again, this is Atlas. Okay, and Atlas, 50% of rotation is, well, I can't do it with one hand, 50% of rotation occurs right here between Atlas and Axis. And then the rest of knotting and the rest of rotation would be taken up by the rest of the cervical vertebrae. I'm going to pause this and walk over and grab the Sacrum and Coccyx. Okay, finally we have the Sacrum and the Coccyx. With the Sacrum, remember that the Sacrum is fused from 5 vertebrae, the Coccyx is fused from 4. The Sacrum has an anterior sacral promontory, and on either side of the sacral promontory we have the sacral ala. There are 2 alae, and we also have sacral foramina, both anteriorly and posteriorly. Those are the sacral foramina. And then if we look from the superior aspect of the sacrum, you can also see the sacral canal. And then finally we have our little coccyx all the way down in here. Okay, so that is the sacrum and the coccyx.